Starting your timing. Total 6 pages.
Okay. Madam, next page. Okay. Okay, ma'am. Okay, ma'am. Okay.
Finished your time. Yeah. Am I audible? I'm starting your
Yes,
10
yes.
minutes. Starting.
Okay. Hello, I'm Dr. Anusha, one of the doctors in the gynae clinic today. May I please confirm your name and age?
I'm Samantha and I'm 29-year-old.
Okay. How may I address you?
Samantha is fine.
Okay, thank you, Samantha. So I have got this information from your GP letter that you are here referred to us as you're trying to conceive for the last 3 years. Is that right?
Yeah, doctor. I'm badly trying to get pregnant.
Mm-hmm. Okay. So what are your concerns for today's consultation?
I just wanted to know what is wrong with me and why I'm not able to conceive.
Sure, Samantha. I will address all your concerns, but as we are meeting here for the first time, is it okay if I ask you a couple of quick questions to know more about you before I can explain you the investigations and come to a mutually agreeable and safe plan? Is that okay?
Yeah.
Okay. So may I know more about your condition?
What condition, doctor? I'm just planning to get pregnant since last 3 years. Me and Peter are together.
Okay.
Uh, so we visited a GP, and he said that I need to run some tests, and these tests were done in the last trust and the here, and I'm here to discuss this.
Mm-hmm.
That's it.
Okay. Some of my questions may sound very personal and intrusive, and but it is required for your management of this thing. So, can I ask you these questions?
Okay.
Okay. You and your Peter and your husband Peter are living together for the last 3 years, right?
He's not my husband. We are about to get married. He's my partner.
Okay. Okay. And may I ask how frequently do you have intercourse in 1 week, say?
Quite frequently, every alternate day or third day, we do have.
Are you aware of your fertile period?
Yes, yes, I'm aware. My cycles are pretty regular. I'm aware of
Okay. When
this.
was your last menstrual period?
It was 2 weeks back.
Do you have pain during your periods or during your sexual intercourse?
No,
Okay. How is the bleeding during your periods? Is it heavy?
normal.
Okay. Any bleeding while you have sex?
No,
Are you up to date with your cervical smear, Samantha?
yes.
Okay. How is your sexual intercourse like with your partner? Is it very painful or do you experience any difficulty?
No,
Okay. So, how are your sexual desires for you and your partner?
Desires are normal, doctor. We do have a regular sexual intercourse.
Mm-hmm. Have you or your partner been treated for sexually shared infections in the past?
Oh, yeah, that was actually a problem with my previous husband. He had gave me this gonorrhea, and when I came to know, I just left him. Our marriage fall apart, and yeah, I had been treated for it at that time.
Oh,
Not
I'm very sorry to know this. Okay. It's been how many years now?
yeah, it must be 5 6 years down the line.
Okay. Were you ever pregnant before?
Yeah, I am having a 5 year old daughter, Simone.
Mm-hmm. Was it a normal delivery?
Yeah, yeah, everything was normal.
Okay. Any surgeries on your tummy or down below?
None.
Or was that a spontaneous conception?
Yes,
Okay. Are you generally fit and well?
yes.
Okay. Are you taking any vitamin supplements for now?
Folic acid.
Okay, that's good. And any allergy to food, metals, or substances?
No.
Any family history of concerns?
No, doctor, nothing to worry. We are
Okay.
staying together, me, Simone, and Peter. Nothing to worry.
So I assume your support is also very good. So, what's your weight to height ratio, if I may ask?
Yeah, I'm 24. I'm very particular about my fitness.
That's great. So, some personal questions. Do you smoke or drink alcohol?
No, doctor. I'm very health
Okay.
conscious.
Okay, pardon me for asking any recreational drugs.
No, doctor.
Okay, some questions about your partner, Samantha. Does your partner have any erectile or ejaculatory problems?
No,
Okay, is he on any medication?
no,
Does his family have any concerning history?
no.
Has he fathered any child before?
Oh, yeah, he's also having a child from his previous marriage, and he's very loyal. After that, we only are together.
Okay, okay, I shall make a note of it. What do you do for a living?
I'm a nurse specialist.
Okay. So are you otherwise okay or feeling low down, depressed in the last few weeks?
No, doctor, I'm okay. Perfectly all right.
Okay, that's good to know. Don't worry, Samantha. So, thank you for all the answering all the questions. So, if you wish to add anything,
No,
okay. So may I examine you in presence of a chaperone and my nurse here will take the temperature, pulse and blood pressure and I'll have a feel of your tummy and examine you down below. If I find any infections, can send swab. If I find any discharge, we'll send swabs for to rule out any infections. Is that okay with you?
okay.
Okay. So Samantha, thank you for your cooperation. I have your reports here with me. Is your partner accompanying you today?
No, doctor, he's on a business trip.
Mm-hmm. Uh, so is it okay, Samantha, to disclose your reports? Do you want to me, my nurse accompanying you?
No, it's okay, doctor. I'm okay.
Okay. So regarding your report, Samantha, I have confirmed the name, age, and NHS number, and these reports belong to you. So this reports suggest that your all hormonal tests that we do routinely on in these patients in your body, that the chemicals that are released are all normal. Only that one hormone that is prolactin, which is raised slightly, but it is not of much concern. Okay, are you with me?
Yeah.
Okay. There are certain special tests which are performed, which is known as a tubal test. Have you been informed about it?
No.
Okay. So let me just draw a diagram to explain you better. Every month, when the women releases eggs from her egg baskets, so that is carried through the special channels which are known as tubes, so that connect the egg basket to the womb, and it is this place where sperm from the partner meet the egg, and actually pregnancy happens. Okay, are you with me?
Okay.
So this the report says that the last part of the tube that is on the both sides show that they are unfortunately blocked and not functioning properly.
Oh my God.
Hmm. I'm really sorry about it. But yes, so these could be related to some of the infections that women may acquire in the past, and that might have caused this blocked tube. There are sometimes some reasons which are unknown as well. Okay, and I, shall I discuss the management options, Samantha?
Okay, so that means you wanted to say that my partner had given me this previous partner has given me infection, and that has led to this blockage. Am I right?
Mm, I'm sure I can see that you're visibly upset here, but sometimes this past infections may lead to such a condition, but many a times the reasons are quite unknown, Samantha.
Oh my God. Now what, doctor?
Yes,
How I'm going
don't
to
worry.
explain.
I assure you that we will provide you the best possible care for you. So, shall I discuss the management options now?
Yes. Yes.
Yeah, so your care will be taken by a team of specialists, fertility specialist, and psychosexual counselors. Also, a specialist nurse will be taking care of you, and also a general practitioner. So, fertility specialist, these are the special doctors to whom we'll refer to you regarding this condition because you may require a special keyhole surgery and to confirm the presence of a tubal block. So the small keyhole surgery is done under anesthesia. So you will also be connected to an anesthetist, through which we can confirm that the condition of the blocked tubes, egg basket, womb, everything will be assessed in the same surgery. Are you with me?
Okay.
Uh, and this procedure usually carries a very small risk. Otherwise, it's a very safe procedure. Small risk of general anesthesia. There are. Do you want me to explain more complications?
No, doctor, I just wanted to know what are my options. I'm okay to
Okay,
take
sure.
this.
Okay, okay. Sure then. So, yeah, so other options, do you wish to know the other options as well?
Yeah.
Yeah. So, if the tubes are found as irreparably damaged, sometimes the fertility specialist may think of removing the tubes as well. Or the best possible option in your condition can be IVF. Have you ever heard of it?
Okay.
Um, okay. So you have heard of it.
I've heard about it because I'm a nurse specialist.
So you must be aware that the eggs are taken from the body of the women and fertilized with the husband's sperm outside the body in a lab and then transferred back to your womb. This is there's another way. There can be a special procedure where a special tube is passed from down below, which is known as a tubal cannulation, can also be attempted, but unfortunately, this is less cost effective than IVF. So these are the all possible options that are available. Um, do you wish to discuss anything?
No, doctor, if I have to go for IVF, will it be funded?
Unfortunately, it will not be funded in your case as you already have two children. But we'll look into other local commissioning groups. We'll get you in touch with them and find out if that is possible for you. Okay?
Okay.
Don't worry, or we'll connect you
Totally
to a fertility.
disheartening, doctor.
Sorry?
It's totally disheartening.
I understand. I totally understand. And I'm really sorry to be the bearer of this news. But there are options available, Samantha. So you don't need to worry. We'll connect you to a fertility specialist and a psychosexual counselor where you and your partner both can visit and, they will help you to cope up with this condition. I'll also offer you some patient information leaflets and contact numbers or support groups and document our discussion, fix an appointment with my consultant, and write back to your GP. Is that okay?
Okay, doctor. Thank you.
Yeah, thank you so much for your time.
Thank you.
Ma'am, how many minutes?
12 minutes.
Oh my goodness. I thought you would stop me, but then I just went on and on.
No, you have to
um,
complete your task.
okay, okay. Then that's fine. Actually, I forgot in between. I just completed the task and then I forgot I didn't tell her that I cannot reveal the husband's report. And since the husband is not accompanying, I forgot to mention that point. This is what I remember just now. Yeah.
Okay. So that's the reason. Go systematically.
Yeah.
First, when you saw husband's report, you go systematically, okay?
Okay.
Okay. Now the positives about your thing is, you know, the basic templates of the task: introduction, aim, agenda setting, concerns, then signposting at time, taking a history. Okay. Basic
Mm-hmm.
template is okay. The management is still okay. I'm worried about your information gathering, dear. Why you took so much of information, and why you take so much of sexual history in detail?
Mm.
Why? Your time taken for history taking was 6 minute 30 second.
Oh my God, that's dangerous. Oh.
No, dangerous is because you are taking so many irrelevant question. After every one question, there were three or four irrelevant question.
Okay.
Okay. See, condition. It is not a condition. Can you just tell me about your pregnancy planning? You can say. Okay.
Okay.
It's not condition. Okay. So your pregnancy planning, you signposted, you asked me about husband, you asked started taking, then husband, you asked something about husband, then dyspareunia sexual history you signposted it, then history of dyspareunia, dysmenorrhea, heavy bleeding, smear, sex painful, desire, all those histories are totally irrelevant. STI history, see, you can make it out all these things. You have to channelize your discussion to a point, and that is the uh, work of a MRCOG candidate. They
Correct.
will give
Okay.
you everything. They will give you
Hmm.
everything. You need to identify where I need to take this consultation. You are not having one-to-one consultation in a closed room where you are having ample of time.
Hmm.
Here you are having a task where you have to find out what is the problem in this case. So it's a block tube according to the HSG. That means rest of the things are normal. Her ovulation is normal. You can assume it means while explaining only I will ask, I means okay, I can see that you have not explained that report, but I will explain in that way that okay, I can see you are releasing your eggs every means regularly.
Okay.
When was your last cycle? Then and there only
Hmm.
ask when was your last cycle. No further details needed because you do not need to ask whether it is painful, not painful. She is having regular sexual intercourse. Her hormonal profile is normal. Her husband semen analysis is normal. Only concern is HSG, that too because of her previous gonorrhea history, which
Hmm.
also she revealed. Okay, that is a history which you have to take. Means you need to. Your task is only to identify the reasons for her blocked tubes and then
Hmm.
guide her regarding the consultation.
I asked her regarding sexual shared infections in the past, so I
Yes, that is actually, but you will be downgraded on information gathering if you will ask so much of detailed
so many
history.
questions. Oh, I understand. Okay.
Hmm? You will be
Mm.
downgraded. You will not clear the domain.
Okay, ma'am.
Family history is not important. Smoking important. Alcohol important. Drugs history. Do not assume that you need to ask in each and every case. Okay.
Okay.
Partner history of dysfunction and all those things. It is not a routine history. She is saying no, everything is normal. Then assume that everything is normal. The partner's hormonal profile is not there. That doesn't miss. So do not go into that male infertility or male subfertility problem. Hmm?
Okay. Hmm.
Okay, so do not ask that history. Examination, whenever patient generally comes to discuss report in RCOG or NHS, we do not need to offer them examination. You can just explain details and then go ahead. Okay, how is she after the procedure? Max to max, you can ask that is information. Okay.
Okay.
Okay. Then you had started explaining me from the uh, he see you asked me whether where is my husband. So here he has been mentioned that Peter is not able to attend today, is having away on business trip. So you can acknowledge that I know your husband is not there, or your partner is not husband, it is only partner. Okay, your partner is
Hmm.
not there. Can I discuss his report? Does
Okay.
it? Okay, so has he given the consent for discussion? If he has given, then you just tell her that okay, everything is normal. If consent is there, then her hormonal profile is normal. Slight raised hormone prolactin, but it is okay. Sometimes it might be raised. Not to worry much about it. Rest of the hormones are normal. Her eggs are getting released periodically. Okay, when was your last period? Here and there only you can ask. Then coming to HSG, this is a BBN. You have to follow a template of BBN. Not in the beginning only you have to ask. Okay, here you can ask. Means it's a, yes, you have to ask in the beginning only. Uh, no name and no details has been given here. Do you think the name and the details of the patient here in this case only name and the details has been given? Rest of the case nothing has been given. Only the case details. Okay, so you assume that this the reports of yours are with me, because none name and NHS number has not been given, so don't assume that it has been given. If it has been
Okay.
given, then only say that okay, name and NHS number has been given. So these are your reports. You assume these are assumptions then, okay? Because here it has not been given. So these are your reports, and we are discussing those reports, okay? So
Okay.
that way you are going to discuss the normal first, followed by abnormal. Since it is a partial BBN, I will not ask anyone to be with her. It is
Hmm.
only in cases of complete BBN where you would like to have someone along with the patient. Here it's a partial BBN. It is not a life-threatening condition, or it is not going to hamper her problem so much. She's having an alternative. So it's a partial BBN. So follow the template of partial BBN. That means some concern we are having. The tubes which are means you have drawn, actually very nicely have drawn and tried to explain me. Um, Explained. So in your case both the tubes as are blocked uh, at the entry, that is a corneal black basically. Mm?
Okay.
4/5 of the tubes and no evidence of spillage. So no lateral, no filling of the lateral 4/5. That means it's almost corneal block. Mm? So that means you have to take it as a corneal block, explain her what it is. Now the next thing will be risk factor. What are the risk factor for this? So that history should be your risk factor. What are the risk factors? So risk factor for tubal blockage are STI, which she has given history, IUCD, surgery, hmm? Yes
Hmm.
or no? Smoking,
Yes.
smoking. These are the relevant points which are important in the history, and your history will be completed by 3 minutes, and the rest of the time you had to explain your options. Okay. Then the options are why psychosexual counselor, dear, here?
Because no, I mentioned counselor,
No,
psycho.
you every time you mention psychosexual counselor.
Okay. No, ma'am, that was by mistake actually. I just meant psychologist or a counselor.
No
Um,
psychologist, it's a counselor, simple counselor. And
okay.
why fertility specialist will do her laparoscopy? Do you think it is worthy of fertility specialist? What they do? Do they do in our country? They do everything, but in Western country there are specific people. So the
Okay.
laparoscopy will be done by a gynec person.
Okay.
Okay,
Hmm.
fertility specialist will come when you are going to referral for IVF.
IVF. Okay. Hmm.
Hmm? So now
Okay.
her option being a gynecologist is that to go ahead with the confirmatory test. Even HSG is not a confirmatory test, so going ahead with the confirmatory test, that is the laparoscopy. It's a gold
Hmm.
standard. It's a gold standard. Okay. So we will see whether there are any scar tissues, whether there are any abnormal tubes. If abnormal tubes and scar tissues, we might release those scar tissue and de-link the tube. That is what the
Okay.
answer key has given, and even the RCOG recommends that if there are hydrosulfings before going for IVF, delinking of IVF, hydrosulfings is important to increase the chances of successful
Having a live birth
pregnancy.
rate.
Yeah, successful pregnancy. So you just need to tell her, so we can go ahead with that, and after that the option will be IVF, or the alternative will be, what will be alternative?
Cannulation
Tubal cannulation, yes, but the chances of success and
are very low.
yeah, we cannot assure her that it is going to get opened. Means we are not very sure. Alternative will be adoption, fostering.
Yeah.
Yeah,
Fosterings. Hmm.
but here you just need to take her permission before discussing the adoption.
Yes.
Don't just blindly tell her, because she's having a kid from her marriage. Her partner is also her kid, so that deprivation of kid is not there. So you just need to take a permission, or if you want more babies, then the alternative will be adoption. She has to fund for her IVF. That is
Hmm.
the thing, and you have to say very firmly. You do not need to run around the bush. Oh no, this is not. You just need to tell her, I'm really sorry to say that in your case it will not be funded, and we will not able to offer you any help. You have to arrange your private funding. Okay,
Okay.
be
Okay.
firm on that. You said that it will not be NHS funded, but then again, why you said I will be seeing to arrange this, that? You say confirm, you say very boldly, no, it is not. You, you are not eligible to get funded for NHS funded IVF. Say
Mm-hmm.
boldly.
Okay.
Okay, no
Okay.
further sentence, no further CCG or ICB. I'm not going to say write it down to anyone. You can very easily make it out. Okay, so that is what the, and that's the reason uh, everything has gone haywire. Mm? Patient
Hmm.
information leaflet will be of tubal blocks, IVF, and laparoscopy. Here you are planning a surgery, so you are going to give her all these patient information leaflet. Just by saying a patient information leaflet, you will not pass.
Okay.
Okay, so you are going to give her means tubal factor infertility, if at all we are having, or link NHS web links, and a PIL of laparoscopy and IVF test baby. Okay,
Yes.
if he is having
Yes.
any concerns. And patient fertility UK is a wide network of people who are connected with this fertility treatment. So it is important. Okay. Now
Okay.
coming to the answer key. Introduction, situational awareness, confidentiality. Why confidentiality is important here? Anybody can guess?
Because we are discussing their reports and partner partner
Yes,
confidence. Yeah.
yes. Patient is nurse specialist. That means she must be working in one of the trust hospital. So you keep on discussing now. Oh, I got that. So that's the reason, that nurse specialist. Okay, and yes, you are having HSG blockage. That might be another issue which you have to be little bit confidential. Okay, so confidentiality, signposting important, discuss report is an aim, setting agenda to plan her care further. Okay, so details of planning pregnancy, sexual history, difficulties, frequency of coitus, fertility period, sexual intercourse around fertility window, any previous history of STI. Now we are coming to the causes of IU, means this blocked tubes. STI, completed treatment, followed up for testing. Okay, uh, IUCD, surgery. These are the risk factor for blockage. Even smoking is risk factor for blockage. Okay, menstrual history, you can acknowledge here. LMP, okay, when was your LMP? Regular. Smear contraception. Ops history, you need to ask, you need to take in detail. Medical history, otherwise fit and fine. Spontaneous conception, very nicely you are asked, okay, that question. Smoking, alcohol, no need to ask. Drugs, any medical condition, uh, family history of diabetes, high blood pressure, BMI, what is her BMI or what is her occupation. And once she, if any time anybody says nurse specialist, please assure them that the information will kept confidential. Okay, support, acknowledge new relationship. Okay, and the details of partner. So those will be completed by max to max 3 minute 30 second. You have to complete it. Check her knowledge about the reports. She will not be, you checked my knowledge. Okay, partially you checked my knowledge. Then partial BBN, all normal, all normal. Do not discuss partner report without his consent. If he has given a consent, then only explain. HSG, BBN block. So I will be saying I am having a concern with your tube test. The tube test has shown a normal uterus, normal neck of the womb, but we couldn't able to visualize the both the tubes. That means there is a block at the entry of the tube, or we label it as a corneal block. Mm? At the same time, these reports are many a times can't be taken as confirmatory, as low sensitivity. That means ability to diagnose true blockages. So we do have options. The options are to confirmatory going ahead with the confirmatory test with explanation of pros and cons. So the positivity of this test will be, we will able to diagnose and confirm whether the tubes are blocked or not. And secondly, if it is blocked, then we can go ahead with the next procedure. That means if there are any scar tissues, if there are any abnormal swelling called as hydrosalpinx of the tube, then we may de-link it, so that if at all you are planning to go for an advanced fertility treatment like IVF, you will get a better result. Okay, so that's the benefit of this test. The cons will be, it's a surgical procedure. You need to subject yourself to the anesthesia risk, surgical risk, difficult entry, sometimes injury to the nearby organ. Although it's a daycare procedure, but these are the risks associated with this. Sometimes injury may be getting identified at the same time. It may get delayed identification. So all those are the risk and complication associated with this procedure. Now, what are your options? So the options of microsurgery or catheterization for removal of blockage will be discussed, but limited microsurgeon, and the success rate of this procedure is limited. We cannot guarantee that the procedure will be successful. Hmm? So this you have to explain to her. And what, when you are going to offer surgery in proximal blockages, okay, whenever you are going to, in distal blockages you are not going to offer surgery. In proximal blockages only, availability of the microsurgeon, availability of the technique, and the success rate is still very low in spite of having a patency tube, okay, tubal patency. And one option is this, the other option will be IVF. But I am really sorry to say that in your case this IVF will not be NHS funded. You have to go for a private funding. Cost of IVF generally they do ask, it is around, I do not remember as of now, but it is something like 2000 or something like that. Somebody
Madam, do we
please.
need to tell her about the NHS? It is not funded even if she does not ask.
Yeah, even if she does not ask, you have to just tell her that in her case it will
Okay.
not be funded, and there might be leading questions. So if at all I need to go for a private funding, what will be the cost? So just check in the NHS what will be the cost of private funding. I think it is something in 1000 2500 or something like that. If somebody will post it on the group, it will be very nice gesture, okay. And alternatively, if not going for IVF or self-funded IVF, the alternative option will be adoption. Would you like to discuss about it? I am sorry if I have hurted your sentiments. Okay. Then here you are going to offer her counseling. Since going through a fertility treatment, it's an overwhelming journey. Counselor is important. Close the loop. Ask any concern she's having. Do not rush if patient having any concerns. Fertility Network UK is a support group. PIL of laparoscopy and PIL of IVF. Okay. Information gathering is fertility focused history. Obtain specific information related to tubal blockage, STI, excluding others. Causes of any previous surgery, use of IUCD, interpret correctly, explain clearly the investigation result and their implication, reassure the patient that case notes will be, I don't know, looked upon, obtained. Okay, so that previous gum means SRH clinic reports will be accessed. This can also be said. Pregnancy and pregnancy details will also be accepted accessed, but I don't think it is needed here, and recorded in the consultation. Communication with patient and families. Your communication with patient was good actually. You were very good with the patient. You were all
Yes.
if I will see that irrelevant history and irrelevant information, but your communication with patient was very good. Keep it up. Okay. Explain the possible reasons for tubal blockages, that is STI. If I ask you it is because of that infection, yes, you have to say, huh, that also one question. You have to say yes, it's the sexually transmitted infection is one of the cause for tubal blockage. You just need to tell her very boldly then also that STI or sexually transmitted infection is one of the cause for tubal blockage. Don't get hesitate. Don't say because of it's your previous partner or this partner, that partner. Here we are just saying yes. Okay. Try to
Okay, ma'am.
be.
Actually, I
You
thought
were
it would be like a
defensive.
pinpointing.
No. You were defensive at that point. Don't be
Yes, yes,
defensive.
yes.
Just accept.
Okay.
Just accept. Yes, it is the cause. It is one of the cause. We are saying it is one of the cause. Other causes are also there, but it is one of the cause and might be, and the gonorrhea history might be the leading cause of this. Okay.
Hmm.
Express
Okay.
empathy for the situation. Okay. Empathy for the situation and patient's disappointment. Gonorrhea contracted from ex-husband be the cause of current situation. Rationale for recommendation of laparoscopic assessment of the pelvis and possible salpingectomy in preparation for IVF. And this funded as not eligible for NHS funded IVF. Conway suggested management plan of IVF. Offer hope. Recommends laparoscopy. Possible tubal surgery before self-funded IVF. Offer PIL example laparoscopy leaflet. Okay.
Yes, ma'am. Understood.
What exactly you are going to go next, that PIL you are going to give her. Okay.
Yes.
Support group, also fertility UK network, specialist reproductive medicine team and involvement of counselor. Okay, so that is important here. Patient safety, basically understanding the risk of laparoscopy, pros and cons. Refer to specialist fertility clinic for further assessment or IVF. Risk of tubal surgery and IVF.
Hmm.
Presents pros and cons of proposed management in the balanced way. Recognize your ability when to involve senior. Highlight all clinical governance issue. Here actually there isn't any clinical governance issue. Okay. Safe allergy, safe prescription. Acknowledge any allergy. Okay. Appreciate
Yeah.
different causes of tubal blockage: gonorrhea, chlamydia, trachomatis, infection, pelvic sepsis, endometriosis, adhesions from cesarean section. Interprets and explain the clinical findings occurrence. Justify investigation and management options. Demonstrate rationale for each. Synthesize a comprehensive and well organized management plan based on the history and investigation. Takes into consideration various factors. Demonstrate sound and comprehensive evidence based plan for this. Okay. Very good. Means a good presentation.
Thank you, ma'am.
Anybody is having any question, any concern regarding this?
Ma'am, actually, I thought dyspareunia and sexual history are relevant in this case, even though she is a case of tubal blockage that we already know. I thought that is also important to ask.
If then your management, you do not assume that everything needs to be managed. You know that what is important. Max to max dyspareunia and dysmenorrhea you can ask, thinking
Okay.
about endometriosis. That might be a
Yes,
reason.
yes,
Okay. So these two
yes.
questions still I will take it, but rest of the
Okay.
history is not that much needed. Okay.
Okay, ma'am. Take care. Thank you.
Thank you.